My name is Lee Chastain. I'm the CEO at West Feliciana Hospital, St. Francisville, Louisiana. West Feliciana Hospital is unique because we serve a very small community. We're the only hospital in West Feliciana, so all their health care is really dependent on what we do. We're a governmental hospital, so we're required to do some bidding, and the bid came in, and we were very, very pleased that the price mark for our Fujifilm equipment was really within our budget. When we purchased the equipment, we had only a mobile MRI, and we had a very small CT that was actually outside of the building. So building a new facility and bringing in this equipment was a game changer for us. I've been pleasantly surprised in not only the efficiency, the serviceability, but more importantly, the ability for us to provide good care. In fact, our radiologist has commented multiple times, these images are superior to some of the others he sees.
I was concerned about the image quality that we might get. And that concern went by the wayside the minute I saw the images that came off of these units. It was fantastic. And we've worked with up to probably 10 or 15 different units, and these are the best we've seen.
I would have to rate my experience with the Echelon Oval and Scenario View as a 10. One of the features of the Oval is the size of the bore. We service a lot of patients who are on the bigger side, so the size of the bore helps us to accommodate all those patients. The feature that I find that's unique with the Scenario View is the lateral table shift. I was able to work 24-hour shift by myself, no lifting help, and I was able to shift the patient and move them on the table and get them positioned without ever having to do any physical pulling.
The reason I had my scans done here, my doctor knows that this hospital is equipped with the finest equipment, and it was right here at home. And he certainly didn't tell me I had to come here, but he recommended that we come over here and have it done. And the CT experience at West Feliciana was really very easy. They helped you get on to the table, made sure that you were comfortable. They asked quite a few times, are you comfortable? Do you need to change positions? It was just easy all the way around, and they explained everything that was going on the entire time.
I'm somewhat claustrophobic, and it was really hard for me to lay there, be still, and complete the whole MRI. This time I had more of an open feeling. I didn't have a problem not moving. I was able to be still.
You want something that's reliable, and that is something that we have certainly experienced with these units. They don't break, and if there is a problem, there has been instant service.
Our relationship with Fujifilm's been great. Being a small, rural, critical access hospital, we have to operate 24/7. We have to operate in an efficient way, and we have to have the backup when we need it. It's important for us to be able to depend on our vendors to come through. And quite frankly, every time we needed the help, they've come through. I would tell any CEO it's certainly worth a look.
My family lives here. My parents live here. And Fuji is allowing us to provide the quality health care that our families need.
You know, building the facility was important. Bringing in the equipment was important. Strategically, we wanted to add on to both of those components by bringing in specialists, which our community had very few of. So having the building and the equipment for us to lay the platform for us to recruit specialists has actually worked very well. Since we've had the equipment, we've been able to incorporate gastroenterology, pain management, endocrinology, and ophthalmology, all because we've been able to provide the equipment and diagnostics that these specialists need. Our community told us time and time again that they want the same services as they have in the big city. So we're fulfilling that obligation to our community by providing specialty services in the location here and be able to provide the same diagnostic quality as they would if they went to a bigger city.